All right, most of America agrees that something needs to be done so that the 46 million uninsured Americans can actually get health care. Well, let's find out from our three guests here, all on the front lines of the health care debate. Three doctors. I'm welcoming back Dr. Remick Hunt, an internist at Princeton University Medical Center, and Dr. George Jenkins, a professor of clinical dentistry at Columbia University, both of them joining us from New York, and Dr. Samson Davis, an emergency room physician who normally works out of New Jersey, but we're seeing him from Las Vegas today. All right, welcome back, gentlemen. So everyone agrees something needs to be done. But we see on Capitol Hill and even from the White House negotiations back and forth about how do you shape this public health care system. So are we all in agreement, meaning the three of you, are you in agreement that some sort of health care reform means that more doctors' offices, more hospitals need to extend Medicare-like bills or payments to these 46 million Americans who are currently uninsured so that everyone can afford to get care? Dr. Hunt?
Yeah, I think there has to be some form of health care, whether it's a multiple tier system, but we really, like, until they get it done, as we said, we have to figure out how to get people access to care as opposed to them utilizing the
But do you worry
rooms.
that that's going to put a greater strain on existing doctors' offices, dentistries, and hospitals, because now you're dealing with a greater volume of people, and it means that some people are going to pay one a figure for an examination versus others who might pay more because they have private insurance?
I think that it's still we still need to have some sort of basic care. Whether you have nurse practitioners and other people that are the main care provider for that patient, and it tiers its way up. But it has to be some sort of system that we put into place where the patient is able to access early as opposed to late. I think that's really the key.
And Dr. Davis, do you think it's possible? We've heard as the politicians go back and forth that possibly with healthcare reform it means that patients will spend more time with their doctors. Is that realistic?
I don't think that's realistic. I mean, I think what's going to happen there will be an increase in patients' visits, but at the same time, let's be honest, the system that we have in place right now is not effective. So we have to find a way so that it's working not only for the doctors and the nurses, but for the patients, obviously. So we're not saying that the rest of the Americans with insurance are going to pay more. That's not the point at hand. It's ways to find how to trim the fat, if you will, to make it more effective, to focus on prevention, to focus on education. I mean, practicing emergency medicine, I see patients come into the ER all the time, and there has to be some restrictions to that. In Austin, Texas, there was 9 patients over a 6-year period who used the emergency department over 2,600 times, costing the system $3 million. And these were all uninsured patients. So, I mean, the thought here is all it starts off with how do we restructure the system so that it's effective for those with insurance and those without.
Okay, and Dr. Jenkins, you know, we've been receiving some emails throughout the week, comments from people all across America, and this one we received today from Maria, who says, I don't mind paying more for everyone to have health care. My health care just went up for less coverage, and I'm not pleased with that. A more universal plan would make sense, and I do believe they should add an extra tax on all items that are junk food, sodas, fast foods, etc. Therefore, all of us that eat unhealthy will be contributing more for our incurred health costs, and you can also add all illegal immigrants that would contribute in that sense too towards their health care costs. So everyone's kind of got some ideas, Dr. Jenkins, on maybe the sacrifices that everyone needs to make so that everyone can have health care. You agree with some of that?
Yeah, I mean, that's a tricky subject, as you can see, as far as the debate is concerned, with people not necessarily wanting to give up some of the funds that they have, or just to kind of spread the wealth, so to speak. That's kind of like a buzzword that isn't very popular. But as I said earlier, it's going to take a concerted effort by all of us. Healthcare professionals, we have to step up and help out. People in the positions of power and positions of wealth, you know, we all have to care about this issue if we're ever going to make a dent in it. But the way it is now, as Dr. Davis mentioned, is not effective, and we have to come up with creative ways that's going to take a little bit of pain on everyone's part. And if we can all share in that, we're all one country, and we can kind of share in that pain and just try to tackle this issue, I think we'll all live healthier lives.
And you know, we've got about 20 seconds left, and I'm wondering in that 20 seconds if we can do a quick little round robin, the one thing that you want to see in healthcare reform so that everybody is insured. Dr. Jenkins, let me begin with you.
Wow, it's so multi-faceted that I can't really think of.
Just give me one thing that you know it's got to be in the package.
I would like to see more, and I always kind of shift the onus on us as healthcare professionals. I would like to see us as healthcare professionals care a little bit about areas that we don't necessarily care about. Some of us may be, you know, we have affluent practices, but if we don't make ourselves available for the at-risk and at-need populations, you know, they'll suffer. And we just have to get more of us out there and interested in
so maybe a public health care plan would mean that even in the wealthier neighborhoods or wealthier practices, they've got to be able to serve people who are not necessarily in that category.
In some form or fashion, in some way that's realistic for them.
And then Dr. Hunt, quickly, what's got to be in the package, in your view?
Well, we just have to have a basic primary care focus, and I think that's key, and then also be able to provide medicines for patients that they need.
And Dr. Davis?
Education. I mean, we have to inform the patient population how best to use the system. Also, I think it has to be better communication between doctor and doctor so that we're not reordering the same tests and bleeding the system.
All right. Dr. Ramik Hunt, Dr. George Jenkins, Dr. Samson Davis, thanks to all of you. Appreciate your time.